We are here at the Fraum Center, my favorite place to come. I am here with Dr. Brian McGinnis. It is great to see you.
Good to see you too.
And this is sort of the inner sanctum. You have places where you actually practice your craft.
Right.
And it's fascinating, the art and science of chiropractics and how it's grown and evolved. Tell me a little bit about you and what we're looking at here.
So, as I mentioned before, I started with chiropractic. So we're just doing chiropractic adjustments, but we realized that chiropractic adjustments can't fix everything. So one of the tools that we use is right here behind us. This is the DRX 9000 non-surgical disc decompression machine.
Okay, so that's a lot of words. Talk to me about, so I'm talking about discs on the back.
So oftentimes when I see a patient, I will do an exam, I will do some x-rays, and we'll see that they have some decrease in their disc space.
Okay.
All right, so that disc has to go somewhere, so it pokes out the back.
Okay.
So it's like a big water balloon poking out the back, and it can put pressure on those nerve roots that come out in between the vertebrae.
So I'm going to be feeling pain or discomfort.
You will feel pain. So it could be radiating pain going down your leg or something like that, or if it's in your neck, it could be going down your arm. And that's a more serious sign. So there's something going on there that we need to get to the bottom of. So that's where the x-rays come into effect in my exam. And then I might find that you would benefit from something like the DRX 9000. So that's one of the technologies that I use.
Okay, keep going. Because what I was going to say is what I hear you say is I come in, talk to you about my symptoms, I get an exam, you do the evaluation, and then you give me a diagnosis and a treatment plan.
I give you a treatment plan.
And what is the treatment plan?
And this is one of the machines that we might use in that treatment plan. This is a very popular one. It's our non-surgical disc decompression machine. In addition to that, so it's not just enough to open up the disc space. There's a reason that disc is compressed, and that's usually unequal pressure on the disc caused from a spinal shift. So your hips might be shifted out to the side, causing that disc to bulge out.
Is that part of the evaluation? You're sort of giving me?
I always look at people's posture. It's a blessing and a curse. I'm always looking at everyone's posture when they're walking down the road. But so if we find that you have one of those abnormalities, it's not enough just to open up the disc space. We have to correct the postural problems. So that's where neuromuscular reeducation comes into effect.
Talk to me about that.
So that's exercises that I use. They're unilateral mirror imaging exercises that will help correct your posture. If your hips are shifted one way, we want them to shift the other way. And so we're not just balancing out the muscles, but we're also fooling the brain. Your brain wants to maintain homeostasis. It wants to stay a certain way. So if we trick your brain into thinking it's going the other way, then that over time will become habit and your body will accept it.
It's really interesting to me as we're talking about this because we're not just talking about me coming in and saying I have an ache in my neck. You're actually looking at me as a whole person.
I have to look at the whole picture, and that's a big difference between where I am now than where I started.
And how does that integrate into the whole practice with you and Dr. Heather and your team here?
So often when we find these problems, such as a bulging disc, something like that, we will see something like degeneration. All right. So I can't fix degeneration. So that's where Heather comes in. So we work together on a case and we will find that somebody has degeneration. They may benefit from restorative medicine. So that's where I send the patient to Heather and she takes care of that for me.
So this is really a one-stop shop, if you will, to put it broadly. You have a lot of different things that you can do.
We've found problems over the years and we have found solutions to those problems.
And you said it changes all the time. You are always learning.
We're always on the forefront of technology. We're always out there looking for the next greatest thing. And we're constantly adding new things to our programs.
It is absolutely fascinating, Dr. McGinnis. I appreciate your time. I've learned a lot. And I have a little boo-boo ache right here. I sort of wanted to ask.
So, yes, we can help that.
We can help that.
Exactly.
Thank you so much.
You're welcome. Thank you.